Today's guest speaker is Dr. C. Suresh Kumar Sir, MD, PhD, CRAV Guru, who has joined us today in 243rd episode of this knowledge voyage. I, Dr. Garima Singh, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vaidya Shri Devendra Tribunaji, President of GB RAB, respected Vaidya Shri Rajesh Koteja Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director RAB. Let us begin the session by seeking the blessings of Lord Dhanvantari. नमामि धन्वन्तरिमादिदेवं सुरासुरर्वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं धातारमीशं विविधौषधीनाम् Om Dhanvantaraye Namah. Now, I would like to introduce today's expert, Dr. C. Suresh Kumar Sir, who is going to throw light on the topic Ayurveda concepts of Marma Chikitsa and its practical applications in Bhagna Chikitsa. It is my great pleasure to introduce Dr. C. Suresh Kumar Sir. Dr. C. Suresh Kumar Sir, MD, PhD, is a renowned Ayurvedic physician and the managing partner of Triveni Nursing Home. With over 3 decades of experience, he specializes in Marma Chikitsa and Ayurvedic orthopedics. He holds a PhD from the Sri Shankaracharya University and an MD from Government Ayurveda College, Thiruvananthapuram. An accomplished academic, Dr. Kumar has presented over 138 papers internationally and serves as a PhD guide and associate professor. His leadership extends to global centers in India, England, and Dubai. He has received prestigious honors, including the Best Clinician Award and Vanshvedya Award. Now, I would like to invite Sir to proceed with the lecture. Before we start the session, I request you all to please switch off your mic. Yes, sir, you may please start the session, sir.
Good afternoon. I'm audible, na?
Yes, sir, you're audible.
So let me share my window first.
Yes.
Am I visible?
You are visible, sir. Suresh Kumar ji.
Namaste, sir. Namaste. Today, we are going to talk to you about Ayurvedic concepts of Marma Chikitsa and its practical application in Bhagna Chikitsa. See, Marma Chikitsa and Bhagna Chikitsa are hand in glove because some people say a Bhagna Chikitsa person is a Marma Chikitsa person, and Marma Chikitsa person invariably does all type of Bhagna Chikitsa also. In Kerala, almost everybody who does Marma Chikitsa knows how to deal with Bhagna Chikitsa. So, my aim of this class is to practically explain how Marma Chikitsa can help you in Bhagna Chikitsa. And this is going to be an interactive session to all my students. Gurus, this is meant for my students, what I'm talking right now. Your doubts can be asked in the chat box. The answers to my question can also be added in that chat box. End of the class, you should be able to at least reduce one dislocation, shoulder joint dislocation, or I will be talking about all dislocations commonly seen by a general practitioner. And I will also make you familiar with fractures and some of the medicine used in it. You might have heard about Muruvenna. Muruvenna is a very famous oil which are using in Kerala. And this is my dream. I always tell my students, you should have a hospital where there should be an emergency center and people all over should come if there is an accident. This is what you see in my hospital recently. And every day, 1 or 2 ambulance will come taking a fracture case into my hospital. And you can see on the right side, this was the fracture that came in that ambulance. So my dream is like that. You should always dream like this. And what Abdul Kalam sir has told, Dream is not what you see in sleep. It is something which you doesn't make you sleep. So with that, this thing I'm going to start with introduction. See, this is another fracture. Can you imagine this can come to an Ayurvedic practitioner? This is what is really happened. So before I start, this is meant for education only. I gratefully acknowledge Dr. P. Hemanta Kumar Sars and Saifuddin Gurkal's work on this. I am quoting some of his work also here. And I told you, you know about Muruvenna. He is my father, and he is the person who brought Muruvenna to the society. He was a professor of Shalyatantra at um, um, Trivandrum Ayurveda College in Shalyandra department only. And after that retirement, he started my hospital, Triveni Nursing Home in Trivandrum. It is basically on orthopedic alone. It is a 62-bedded hospital, and in that hospital, we don't use even a single paracetamol for our day-to-day activities. Whatever pain relief, yeah, we do it only with Marma Chikitsa. And my students who you can ask them, they might be aware. And this is the prologue. Orthopedics in Ayurveda is so well developed that nothing need to be added or deleted from the text even now. You might be thinking this is a very tall claim because I'm talking in 2026 where there is in my city Trivandrum, which is the capital city of Kerala. I am standing my hospital is situated in and around 5 or 6 super specialty hospital, and my son is an orthopedic surgeon. Still, I attend 10 to 15 fractures on daily basis. So, if this is the strength of Ayurveda, if I can do it, everybody should be able to do it because I am doing it standing in the bold shoulders of Sushruta. No wonder why Sushruta is said to be the father of surgery. The concepts are seamlessly documented with the help of without the help of an X-ray or modern diagnostic gadgets. See, Suchita has done with extensive cadaver dissections. So I'm talking just with us seeking the help of Sushruta only. So as I told you, if I have seen further, it is by standing on the giant shoulders of people like my Sushruta, my teachers, my father. I, with all respect, I remember before I start this talk. This is what a famous quoting it says that killing somebody with a touch is not a big deal, but with a touch, if you can make them come alive, that is a big deal. Sadguru Jag Vasdev. So once you think about Marma, most of us you can see this might be what that comes into your mind. You know which cinema it is, and you know which Marma is these two. If you those students, please you can write in the chat box which movie is this. This is also one Marma. And next is another movie from Kerala, from Malayalam. And here also you can see he's a very versatile actor. He met with an accident and he is in quadriplegic. This is also one Marma. See, Marma is a very, very, very common word which we use on daily basis. Here I am showing you an X-ray where a patient had a fall and had a both bone fracture, and she went to a modern hospital and he did a operative reduction and internal fixation. She was an epileptic patient. She had yet another fall after 2 to 3 months, and she had yet another fracture. See the amount of trouble this lady has to undergo just because now they have to tear open the whole area once again, remove the implants, remove the screws, and then you have to fill the screw area where the bones are not there, then redo it once again. Now the whole world is going for conservative orthopedics. Here also you can see a person walking, and you can see there is a false joint over here, and this is the fracture it happened. I'll show you what I did in that the class goes on. Here you can see a shoulder joint dislocation, recurrent shoulder joint dislocation, who underwent putty plaits operation, and you can see there is a scar over this region. I don't know whether you can see my mouse. There's a scar over this region, and the patient was unable to move his hand up or down. And what I did was what exactly Sushruta told, and you can see here, this is the operation discharge summary of this person. And you can see what did Sushruta says, Sandhim Shira Vimuktamstu Snigdan Svinnan Mrudu Kradan Uktair Vidanir Buddhyacha Samyak Prakriti Manayet. That means we have to do Snehana and Svedana. We did all the same with Brahmana Jilsa, and the patient became all right. The video you saw is what we have taken after 14 days of treatment. So these are certain areas where Ayurveda can really contribute. Can you see this? This is another fracture where it came here and we did a bandage like this. You can show you another fracture. And on the right side of your screen, I will show you one shoulder joint dislocation. A patient coming to our clinic, to an Ayurvedic hospital, can go back after reduction within 5 minutes. Can you see this? See, this is how we reduce a shoulder joint dislocation. My aim of this class is to teach you how to reduce at least a shoulder joint dislocation. I hope you will all cooperate with me. So whatever doubts you have, you can ask in the chat box. I'll be able to explain you. These are the different types of fractures. Now you can see short skirts grade 5. This person came to my hospital when Dr. Manoj sir from All India Institute was there along with me. After seeing this fracture, he told me if it is there, they will go for internal fixation. You can see on the 41st day, this is what happened on 41st day. And this is on the first day, and this is on the 41st day. You can see him walking. See, I have not done any wonders. I have done as per Sushruda's statement. I'll explain you because there's nothing I want to hide here. And see, this is another humerus shaft fracture, and this was done by my one of my RIV guru Srival's son was there in my hospital, and he only documented all this. See, on 8/7 it was like that, 15/7, 22/7, 29/7, and 5/8, and the patient became all right. Another is bimalleolar fracture. You can see here, the person is a 62-year-old person and he had a fall, and this is on the first day he came to me. And this was a fracture, the X-ray I took, and the patient is able to walk. Please don't think that in Kerala, almost all cross-section of people approach to an Ayurvedic doctor for their orthopedic problems. Not only very poor people, even the topmost brands, even the film stars, they used to come to Ayurveda for their orthopedic problem. This is the strength of Ayurveda. Here I'll show you one IVDP, intervertebral disc prolapse. You can see a large superiorly migrated disc in L5S1 level. After 3 weeks of treatment, he have done another MRI. You can see the previously seen large superiorly migrated herniated L5S1 level is not seen in the present study. Like this, I have around 300 before and after MRIs. So my 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 line is, if I can do this, we all should be able to do this. This is another area where Ayurveda can really contribute. That is sports medicine. Here you can see Hullela Gopichand, who has here for his tennis elbow. Like that, Javagal Srinath was here for his ACL tear. He came here, did treatment, went back and played for India. So this is not anything magic. This is just with the proper theory I am able to explain it. Here I will show you an MRI of a right knee, where on the right side of the screen you can see there is a tear in the lateral collateral, medial collateral, ACL, PCL, all the ligaments have been torn. And see, you can see him walking on the 21st day. And what is the treatment I did? Nothing. First day I immobilized it. Then after 3 weeks of treatment, we did another 3 weeks of strengthening exercise and the patient became all right. He happened without my knowledge. He went to another center in Coimbatore, Ortho One Center. It's a very famous center for orthopedic problem and told he has an ACL tear. And he went and showed to him without my knowledge. Then what happened? This patient, this daughter and my son is studying together in one of the medical college. They know each other. He called me and told me, sir, whatever treatment you are doing, you please do. Let us document and present a paper for this. He's still walking. He recently he had yet another fall and came with an injury in the shoulder joint. So before these are the strength of Ayurveda. Ma'am, am I audible now?
Yes, Suresh ji.
Yes, sir, you are.
Yes.
Yeah, okay, thank you. So common person had enough knowledge on Marma Chikitsa. That is why ladies wear bindi. You see any god's photo in and around you. There are certain areas they cover, and all these are called marmas. See, marma, the word marma means that should not be revealed. That should be covered. So you can see in this photo also, there are certain areas where the whole body is covered, and these are marma areas. Earlier, three people were practicing Marma Chikitsa. One is Ayurveda community, second is Tamil community, and third is martial art community. Why all these people were practicing Marma Chikitsa? Because their philosophy were also different. In Ayurveda, they consider Marma as a very sacred point and it should not be disturbed. So while doing surgery, Sushruta says, Tasmat Marma Sadanam Parivarjaniyam. Please don't tamper those areas while doing surgery. But in Tamil, they consider Lord Shiva as a repository of the knowledge. It was seen in early Dravidians, and Lord Agastya were considered to be the god of Marma Chilsa. They consider not Marma but Varma. In Ayurveda, we have 107 Marmas, but in Tamil, they had 108 Marmas. They consider it Dhatu Chikitsa. And a Nadar community were those people who were practicing Marma Chikitsa. Agastya had 18 disciples, and all of them wrote books. Coming to martial art community, they considered Lord Parashurama as the repository of the knowledge, and Parashurama, while created Kerala or southern India, they brought 18 people from the north and they gave 18 places. All of them started developing their own schools, and Kalari means school. And from there only this martial art developed. And they had 64 knowledge, 64 marmas. So for Ayurveda, it is 107, for Siddha is 108, and for martial art, it is 64. According to Ayurveda, it is Adi Deviga and Sangada Balapravata. As I've told you, I'm skipping Ayurvedic part of Marma Chikitsa because we all know that no treatment has been told. Nothing has been told about Marma Chikitsa. Only these are the points it has been. Marma Nidana is told, but Chikitsa has not been told. So I'm skipping that and coming to Tamil. They say Sage Agastya is a repository of knowledge, and as I told you, he had 18 shishyas, and all of these 18 shishyas have wrote books. I have all those books, and even to decode one book, you need a lifetime. I'm trying my student, giving it to my students to decode it so that we can bring that knowledge forward for the future generation. And you go to Kerala every day, the puja in each temple there will be going on, and that is giving strength or power to the deity. But you go to any other temple in Tamil Nadu, you can even go inside the sanctum sanctorum, even touch the god. Here the power of this god is due to because of a siddha that has had samadhi in that place. I have told you earlier, Agastya had 18 shishyas. wherever the Siddha had Samadhi or death, big temple has come. In Trivandrum, there is Padmanabha Swami temple. That is a place where Lord Agastya had Samadhi. You have heard about Palani. There's where Lord Bhogar has Samadhi. Madurai Meenakshi temple is the place where Sundaranadar, and Kumbakonam is where Tirumula. Like that, there's a 18 areas where 18 temples have formed. And the whole Tamil knowledge is in a combination of Malayalam and Tamil, and it is in a poetic verse. Like, just like we have Sutrasthana, Nidhanasthana, etc., they do also have Sutrasthana and Nidhanasthana. As I've told you, there are 108 points, out of which there are 12 major varmas. They don't term it as marma, they term it as varma. And one major marma has 8 satellite marmas. Totally 12 major marmas into 8, 96 satellite marmas, total 108. This is how they consider. And these are the books that are available. These are books I have with me also. 26 books are available even now. Then coming to martial art, I told you 3 people were practicing. One is Ayurveda, second is Tamil, and third is martial art. This martial art they consider 64 marmas. You see, in olden days there was not a unified code of law. There can be, each and every place were governed by chieftains or kings. So one king has a problem with another king. What happens? They don't go and fight each other. They will allot one person from their community, and other person will also allot that another person from community on a fixed date, fixed time. This person will go and fight, and one of them dies. Whoever wins, that king is said to be the winner. So the knowledge of Marma to these people are very precise, and there it is very accurate. Even the nomenclature of that Marma is also very accurate. For example, Angushtam, Anguli, Madhyastam, Kshipram. That is one what we call as Kshipramarma. In Tamil, it is known as Kavali. And in Kulayana or martial art, it is known as Kai Tuki. That means if you injure that part, the whole hand will become lame. So even the nomenclature of that marma was different. So I had told you earlier, Kalari means school. The place where you are being taught is known as Kalari. And this is also I told you earlier. So I will talk this slide with the present knowledge. See, you are in a sports arena. You are in a sports, something happened. The first thing that you do is a first aid. Then you go for a proper treatment. Then you go for a yearly treatment. And then this is what Panchatattva means. The X for you to become a good Kalari or Marma practitioner, you should have the proper knowledge of Marma. You should know exactly the place of Marma. Then Prayoga. Prayoga means the first aid. If at all you get injury in somewhere, the first thing you should do is a Prayogam. And then the definitive treatment is known as Pratividi. And finally, the treatment yearly which you have to undergo is known as Chikitsa. This is known as Panchatattva. This is very interesting and we practice even now. Another interesting part of Kalari Chikitsa is Saptaha Chikitsa. Means whatever the type of injury you have undergone, whether it may be a fracture, whether it may be a head injury, a chest injury, pneumonia, etc. If it is due to a trauma, first thing you have to do is you have to undergo 7 days Ksheerabhaga treatment. That means first day with Lajalu, second day Prishnaparni, third day Vasha, fourth day Shalaparni, fifth day Apamarga, sixth day Vilva, seventh day Kashmiri. Ksheerabhaga procedure we all know. We have studied in our Rasa Shastra. So 1:4:16. One part of leaf, then 4 part of milk, and 16 part of water. Boil it and make it into 4 part. Squeeze it and take it. This is Saptaha Chikitsa. This is another concept called matra. Matra means a force needed for you to injure that marma is known as matra. That is, it is the volume of force. How will you consider matra? Means you stand 50 centimeters away from a banana tree, and you try to immerse this much part of your body, I don't know whether it is visible, inside the banana tree stem. The force needed is known as 1 matra. Why I am teaching you this is because if I want to teach my student, I should use only 1/4 the matra, prescribed matra. For example, Talakrit, if it is 4 matra, we should use only 1 matra to teach my student. If I want to treat, I should use half the matra. That means 2 matra. If I want to injure you, I should use full matra. This is why matra has been told. I'll, I'll show you one practical example done in NIA by Hemant Kumar sir. See, he has done in Gridrasi, there are two, you all know what is Gridrasi. Gridravat asyade, the person having pain like something is eating by a eagle. And then this is a shloka, Vayu Katyashra Shuddha Samo Vajane Drujam Kadigraha. We term it as Kadigraha also. And speak Pura Kadi Brishta Janu Janga Padakramat. Then there is fasciculation, Spandade Muhur, and scoliosis, Dehasya Adivakrada. All these have been told in our text. So these are the various areas where Kadigraha has been told. And what did I do? See, I have given pressure in certain points all over the body. Pada Kshipra Marma, Pada Talahir Marma, Gulbha Marma, Indravasmi Marma, Janu Marma, Ani Marma, and Urvi Marma. See, in Tamil, Uchi Marma, Churiyadi Marma, Chora Tandagalam, Pushti Marma, and Nangana Purutha. These are the areas where we gave pressure. How did we give pressure? Each marma is stimulated 16 to 18 times in the same rhythm of inhale and exhale by digital pressure in one sitting. The rhythm of stimulation is same as the rhythm of respiration. See, this is how we did it. Pada Kshipra, Pada Talahrit, Gulbha, Indravasti, Janu, Ani, Urvi. All together, this is how we did. You can see here, before treatment it was like this, and after treatment you can see like this. You can see here, before treatment and after treatment. See, it is in a sitting in a matter of 2 to 3 days. See, this is on the same day itself. So, this is the strength of Ayurveda. So, Marma can play a vital role in all of our treatment modalities. So, coming to orthopedics, see, Ayurveda has proper nomenclature for all bones. Clavicle is known as Akshagasti, scapula Amsapalagasti, humerus Pragandasi. This is not found by me. Suchira has told this. Ulnam is Andha Pragoshtasthi, radius is Behir Pragoshtasthi. Like they're coming down Sroni, Balaga, Urvasti, Janvasti, Jangasti. I'll write only this name in all medical certificates. So there is a lot of medical legal cases coming to us. I write he is suffering from Praganda Munda Vishlesham. So I will be summoned to the court. Sir, what is this Praganda Munda Vishlesham? So I say this is a shoulder joint dislocation. So even the judges have now certain knowledge about all Ayurvedic terms or fractures. Coming to bones. The word asti is developed from the root asukshebane. That means carnivorous animal, after eating the bony part, fleshy part, throws away or discard the bones. So whatever that is thrown away, Sushruta or his predecessors have seen that certain dhadus have been thrown away, and he termed this as asti. The word osteology is also developed from the root asti. As you all know, the bone has a loosened part and a compact part. The compact part is known as cortex and the loosened part is known as medulla. Ayurveda also says the compact part is known as karkara and the loosened part is known as pelava. The definition of Bhagna, Bhanja Amardane. That means the cause of fracture are mostly external. And definition as per the modern, loss in the continuity of the substance of the bone. See, what is a dislocation? Dislocation is a complete and a persistent loss of congruity between the articulating surface of a joint. That is what Sushita also said. What is a sprain? It's a complete tear or incomplete tear of a ligament or a complex of ligament. Nadi chinnam, nadi binnam, ubhedo lakshananidam, vishamam ranam angeyattat, kshadam to abhinirdihe. Even if you have a ankle joint ligament tear, what you write is gulba sandikshadam. Kshat. So we have read this. So we are coming to the bones. There are 5 types of bone: Kapala, Rujaka, Taruna, Nalaga, and Valaya. Why did Acharya say all this? Because each and every bone has different types of pattern of injuries. For example, Tarunasti Namyande, Bhajyande, Nalaganitu, Kapalani Vibandi. Because fractures can occur only in long bones. In cartilage, it can only have a dent. In Kapalani, it can only spread or burst. So that is why the different types of bone has been told. Now, how many types of joints are there? There are 8 types of joint. Kora, Ulukala, Samud. These are we all learned in standard first of BMS. Pradhara, Tunya Sevini, Vayasatunda, Mandalavarta, and Shankavarta. So, students, what is Samudga means? It is a ball and socket joint, or Ulukala means ball and socket joint. How many ball and socket joints are there in our body? 1, 2, 3, or 4? Please write in the chat box. Yes. The modern medicine considered orthopedics into 2. One is trauma and next is cold orthopedics. Ayurveda also consider trauma as Bhagna Chikitsa, and other like low back ache, tennis elbow comes under Marma Chikitsa. So classification is divided into Kanda Bhagna and dislocation, Sandhi Mukta. Another classification is a simple fracture or a compound fracture. Simple fracture means Savrana Bhagna. Simple fracture means Avarana Bhagna. Compound fracture means Savarana Bhagna. So see how much detail Sushil has told. Then all are Agandu and Nija that we have told. Even Agandu, after 7 days, we should treat it as Nija. Agandu Ranvedi Nijam Vigaram, Nijastada Agandum Avipravada. Tatra Anubandam Pragadim cha Samyak, Nyatva Tata Karma Samarabeda. We should wait for 7 days for Agandu to become a Nija Vigara. Then, this is the first accident that occurred in the history. Now, what is the Nidana of Bhagna? Acharya says, Padana, Pidana, Prahara, Akshebana, Vyala Mrigadashana Prabhatibil, Anega Vider Astnam Bhagnam Ubadishandi. What is Padana means fall, Pidana means compression, Prahara means violence or blow, Dashana, bite of violence. Why did Acharya says like this of the Nidana? He would have told just a fall and a fracture. Because each and every fracture, the Nidana varies, the fracture varies. On the right side of a screen, I have shown you one fracture which the patient came and told me, sir, I had a fall. He happened to be one of my relatives. I told, okay, because this fracture can occur only if you start hitting a person. This is known as boxer's fracture. You can have a fracture over here or the knuckle. Anything can break. So I told, okay, fine. You go take an X-ray, but tell me the person whom you hit is still alive or dead. Because these people were trying to oversmart us, but they should know that we are smarter than them. So that is why Sushil has told different types of fractures have been told. Then, what is the Samanya Lakshana of Sandhi Moksha? Prasarana, Agunjana, Vivartana, Akshayvana, Ashakti. Any movement of a joint is impossible. Ashakti, impossible. Ugra Rujatvam, severe pain. Sparsha Sagatvam, tender. Chedi Samanyam Sandhi Mukta Lakshanam. Can you tell me one more symptoms other than this as told by Sushila? Prasarana, Agunjana, Vivartana, Akshebana, Ashakti, Ugrajattam, Sparshasagattam Chedi, Samanyam, Sandhi Mukta Lakshanam. See, so even in 2026, I cannot find even one more symptoms other than what told by Sushruta. This is not my opinion. Whomever I have taken class, they have told me like that. Then there are 6 types of dislocation. Utpishta, Vishlishta, Vivartita. I will talk to you in detail. What is Utpishta? Vaisheshikam tu Utpishte, Sandhavu Veda Shobho, Vedana Pradurbhavo, Visheshadascha Nana Prakaro Vedana, Ratro Pradurbhavandi. This is fracture dislocation. The X-rays, all these X-rays are not downloaded. These are the X-rays that came into our hospital. Then, Vishlishtam. We all know a person with hemiplegia, one side paralysis. You watch his shoulder joint, you can see there will be a drooping of shoulder. That is known as Vishlishta or subluxation. Vishlishte, Alpashobho, Vedana Sadatyam, Sandhi Vikriyacha. Then Vivartidam. Vivartidam means joint is shifted to one side. Vivartide to Sandhi Parsha Abagamanat Vishamangada Cha. That means the joint has gone laterally. I will explain you in some other way. A person coming to your clinic with a shoulder joint dislocation. How will you identify the shoulder joint dislocation? We all know the symptoms. What are the symptoms? See, this is a symptom. Prasarana, Agunjana, Vivartana, Akshepana, Ashakti. Ugra Rijatam. The patient is unable to move the joint. There is severe pain, and the patient coming to your clinic. You know this is you think that it could be a shoulder joint dislocation. So what will you do? You will send it for X-ray. What happens? The patient goes to the X-ray. He finds there's a dislocation, and the patient vanishes from that place. If you can identify at your clinic with this, with clinically, you can reduce it and you can earn fame and name. How will you identify? A patient coming to your clinic with the hand held towards the body is usually anterior dislocation. In shoulder joint, there are 3 types of dislocation. It can be anterior, posterior, or inferior. If the hand is held towards the body like this, I don't know whether you can see me or not, it is known as anterior dislocation. If the hand is held away from the body, it is posterior dislocation. If the hand is held over the top of the body, it is inferior dislocation. So, there are 3 types of dislocation: anterior, posterior, and inferior. If the hand is held towards the body, is anterior. Hand is held away from the body, is posterior. If hand is held towards above the head, is known as inferior. That is what Sushruta also says. See, this is a lateral displacement. Tiryakshipte to egasti parsha bhagamnat atyartha vedanacha. Then we have learned about medial earlier, lateral, and these are the different, the inferior type. All this we have learned. So there are 6 types of dislocations, and out of which shoulder joint has 3 types of dislocation. I hope you all know. Please write in chat box whatever you have learned: anterior, posterior, and inferior. See, anterior, you can see a prominent prominent humeral head. In posterior, you can see there is a lighted bulb appearance. Inferior is self-explanatory. So how are you going to treat this? See, Sushruta says, Musalena ulkshipe kaksha vamsa sando visamhade sthanasthidam cha betniyat swastigena vijakshana. My dear students, you just in your chair, you try to put your hands up. I don't know whether you can see me or not. You put your hands up. And then after reaching the top of this, you turn internally. I'll show you here in the, see, keeping the hands up, then turn internally, and you can feel the humeral head in the armpit. With a small pressure, you give a pressure and bring back to normal. See, this is something we can do it in your clinic. I'll show you once again. This is what you have learned, coach's method. I have never even tried once with this method. This is a crude method. See, this is another method which we have been taught. See, this is, you can see here, there's an anterior dislocation. You can see after bringing the hand over the top of the head, the hand is held internally. Once you held internally, you can see there and very smoothly in the armpit. Then with a small pressure, you can bring back to normal. See, this is I'll show you this once again. You can see my hand. I am giving a pressure in one marma, and that marma giving pressure, the pain towards the shoulder joint get reduced. You can see in corpora area or the elbow joint, I am giving a pressure in certain areas. See. As simple as that. So hereafter, a patient coming to your clinic with a shoulder joint dislocation, you should be able to reduce it. It is very easy, and don't get panicky. You do like this. And if you are stuck somewhere, you can call me. I'll give you I will share my phone number. You can call me, and I will come to the video call and I'll be able to help you. See, this is one of my students who in the interior of Kerala, a patient came and he was unable to reduce it, and we reduce it through shoulder joint so video call. You can see on the right side how happy this person is. Unreduced and after reduction. So what is the benefit of this? It can be done without an anesthesia. The patient can return home within an hour. It is less painful and can be performed by one surgeon. I hope this is useful for you, and hereafter a person coming to your clinic, you should be able to reduce it. Then coming to elbow joint. Elbow joint also, you can see there are different types of what it Sushra says, Kaurparam tu tatha sandhim angushtena anumarjayet. Anumrajya tada sandhim pidayet kurparam chudam. See, this is what. Since it's an online, I am unable to demonstrate. What you have to do is you just give a shake hand to that person. While giving a shake hand, give a small pressure in the Kshipra Marma and give a traction, counter traction, and with your thumb you give pressure and bring back to normal. This is also very easy. So we have learned two dislocation: shoulder joint, elbow joint. Now patella. See, this is what patella dislocation is. Give a traction and bring back to normal. See, you have almost become a orthopedic surgeon now. From your name, you can write BAMS, specialist in bone hereafter, from today onwards. See, these are the commonly seen dislocations which have reduced. And you have any doubt, you can ask me in the chat box. Now coming to the fractures. What are the cardinal symptoms of a fracture? Shvayadu bahulyam, spandana vivartana sparsha asahishnatvam, avavidemane shabda, sastangada, vividha vedana pradurbhavo, sarva avasthasunna sharmalabha. Then Shvayadu bahulyam means there is swelling. Spandana vivartana sparsha asahishnatvam means tenderness. Abavidemane shabdas means crepitus. Sastangada, loss of transmitted movement. Vividha Vedana, different types of bones and discomfort in all postures. These are the cardinal symptoms of a fracture. See, these are the common type of modern classification. We are going to Ayurvedic classification. There are 12 types of classification. First is Karkadaga. Visheshadastu Sammudham Ubhedo Asti Madhye Bhagnam Grandhirivonadam Karkadagam. Can you see this? This looks like a crab where there is a point of entry of the force and there it looks like a crab. That is why he termed it as Karkadaga. Can you see this is as Ashwagarna? It looks like resemble like a horse ear, that is called as spiral. Then Churnida, if there is multiple fragments, we term it as comminuted fracture or Churnida type of fracture. Then Pichidam Pradhudangadam Analpashovam. See, there is severe swelling and crushed injury with huge swelling. Then, this is another concept told by Sushruta alone. Parshayor asti hinodgadam asti chalidam. That means subperiosteal fracture. See, you have an injury over your limb. The covering of the limb is known as periosteum. Periosteum is intact, but there is a cortical tear inside. That is known as subperiosteal fracture or asti chalida. Challa means covering. Covering of bone is periosteum. Bhagnam, very good. Transverse complete fracture. Velade Pragambamana Kandamagan. Majjanagada. Another very good concept Sushruta told. Because elderly lady, after a small fall, even she had to sit in the commode while going for the toilet. She complained there will be pain in the groin, not on the buttocks, not on the thighs, not anywhere else, in the groin alone. She might even walk into your clinic. Once you make her lie down and see the length there will be shortening. Why? Because there is an impaction. Asti avayevo asti madhye anupravishya majjanam unnahyedidi mujjanigada. So that is what the patient might even walk into your clinic because it is an impacted fracture. Adipaditam asti nisheshada chinnam. Then vakram, your son, grandson, whoever it may be, or you yourself, if you are a small boy, you just had a fall. There will be a fracture, but it is not totally detached. There will be only a bending. Bhugnam avimuktasti. There is a fracture, but avimuktasti. It is not detached. That is known as vakram. Chinnam, anyadara parshavashishtam chinnam. Then padidam, it is seen in irregular bones, flat bones. Then spudidam, earlier teeth were considered as bones. So any injury or a split fracture or a burst fracture it is known as spudidam. Then you might be asking, what about pathological fractures, sir? Various areas Sushruta has told, asti viddhati, asti grandhi, asti kshaya, majja kshaya, and in Harita Samhita, asbalida asti has been told as an abscess leading to fracture. These are the pathological fractures. These are some of the rare fractures seen. Now the patient coming, you have learned about the Nidana types of fractures. You are in your AC clinic of an orthopedic surgeon in your consulting room. A patient coming, so what will you do? You go for case taking and then investigation. What is the gold standard method of investigation for a fracture? It is X-ray. And we have seen so many X-rays, and then we saw there is a fracture. I always tell my students that you should know your limitations. You should not take all fractures. There are certain fractures which can go to complications, and we don't have enough medicine to counter that complication. One such fracture is this. Here you can see that there's an intracapsular fracture of the neck of femur. Because of the peculiar type of blood flow, what happens once there is a fracture here, the flow distal to this will be tampered, and the fracture, even though it heals, the head will crumble away. So you should be very careful. You should have a good guru to teach you certain things which won't be able to deal with. So this is why I always tell my students, you should not take this. Now you go for radiation, so X-ray, and the patient comes with the X-ray. This is the first X-ray taken. This is the X-ray room earlier. It is in 3 houses. Now this is my X-ray unit, which is in less than, it's a 300 mA X-ray unit. There are various ways of writing an X-ray. It should be always an AP and lateral view. A joint below and joint above should be included. X-ray request should specify the area of suspicion, and always try to go for AP and oblique view. There are certain other views also. Skyline view, you can see here, Judith's view, oblique view, and also merchant view. these are other special views are also there that doesn't comes under our purview right now, because this I take to my postgraduate students. So once you should always go for AP and view. What do you think this is? A tiger eating its cub. But what exactly is it is carrying its cub to his to her home. So you should always go for AP and lateral view. Then you can see there is no fracture here. But once you go for a lateral view, you can see there is a huge fracture. That is why you always say go for AP and lateral. There are rules of 2, etc. We don't have time to all this. But I always tell my students, you should develop a protocol for reading each and every X-rays. I'll show you one protocol for reading a spine X-ray. There are 13 points to note while reading a X-ray spine. First you should see is a spinal deformity. There is a mnemonic for this, which I'll tell you later. See, this is a scoliosis. First, you should see spinal deformity. Second, you should see shape of vertebra. Here you can see there is a wedge compression fracture. And third, you can see density of vertebra. See, there is a sclerosed change of this. And fourth, you should see intervertebral disc space. On the left side, it is normal. B is, there is erosion, and C is totally eroded. And you can see the transverse process, there is a fracture. Then you can see spina bifida. And then comes sacra. You can see there is a huge fracture in the sacrum. You can see there is a sclerosed sacroiliac joint. Then paravertebral soft tissues. You can see here. These are things which you ignore. And then pedicles. You can see the eyes, a round thing over this. These are said to be the eyes of the spine. If eyes are closed, always suspect it could be cancer. If the letter P, these are said to be the eyes of the spine. Then here you can see facet joint. Can you see there is a dog-like shadow here? Dog-like shadow. If that is there, it is normal. If you cannot see, then you should think that it could be a listhesis. Then vertical and sagittal diameter. These are the 13 points you should learn or you should see once you start watching a spine X-ray. See, our mind will see only what we know. So you should know all this before learn. If you're trying to, like that, this is what I told you, that Scotty dog show, a dog-like shadow was seen over here. Then like that, in X-ray chest, we have 10 points. Now, the patient came, you took the X-ray and patient came. So what should you do? We have to do 3 R's: reduction, retention, and rehabilitation. Bhagna sthapanam, Bhagna sthirikaranam, punachcheshta prasaranam. And did you know that the first thing the patient right now people use is price protocol? Sushila also said, Alebanartham manjishta madhugam rektajantanam shadadauta gridopedam shalivishtam samhare. He says that you should use cold irrigation first thing that when the patient comes. And second, did you know that plaster of Paris is told in Ayurveda? I am not telling. Adau bhagnam viditvatu seje shidalambuna pangena alevanam kuryan. Panga means one type of clay were used in earlier time for immobilization. And that modified clay is now becoming plaster of Paris. Then, what are the principles? Anjanam, Pedanam, Samkshepa, and Banda. Traction, manipulation, opposition, and immobilization. Just after reduction, how will you know the patient, the fragments are properly aligned? When the pain get reduced, when the stiffness has come down, you can take an X-ray and you can see it has been properly aligned. After alignment, we are go for bandaging. For that, we use splints. What are the type of splint used earlier days? Even now, I use bamboo splints. Madhuga udumbara ashwattha palasha kakupattaja vamsha sarja vadanam kushartham upasamharet. So, These are the different types of splints. Here I am using one pipe, one PVC pipe. The first X-ray I've shown you, that person was not walking. I started putting a bandage, and then you can see with the bandage he is able to walk freely. So even a proper splint can be used for, see, you can see him walking. So this is what we use. Then bandages. You all know there are 15 types of bandhas. Kosha Swastika Muttoli, China Dama Anuvelidam, Katwa Vibanda Sthagiga, Vidana Ulsanga Gobana, Yamalam Mandalakyam. And Charega Sushudha Ashtangada says Ulsangi also. Total 15 types of bandages are there. You can see you keep 1 day session on bandages. We will demonstrate, we will teach you all these types of bandages. All 15, 16 and extra bandages we'll be able to show you. See, you can see here a small boy doing a scalp bandage. See, first he had a fall, we took a CT and found there is a subdural hematoma. We have kept some medicine and we have put bandages over here. Each and every injury, the bandages vary. Here in knee joint, for ligament tear, what type of bandage you are doing. And because of paucity of time, I cannot show you for patella fracture, what are you going to do. And also for effusion. Ankle joint also, we have different types. So how many days you should do bandage? Saptaha tata saptaha, saumeshu rudushu bandhanam, sadharaneshu kartavyam, panjame panjame ahini, agneshu trihat kudyat. Bhagna means here in our hospital we do every 5 days. We ask the patient to come and rebandage it. It should not be too tight. It should not be too loose. It should be a moderate. Tatra adishaidilam bande sandhisaidam najayade gadena bitogadinam shovorukpage evacha tatma sadharanam bandam bhagnesham sad. Now my students, I have around 16, 17 students around me. They ask me, sir, when can we remove the bandage? What did Sushra says? Bhagna sandhi manaviddam ahinam angam anurbanam sukha cheshta pracharam. That means when the pain has come down, when the stiffness has come down, it is time for you to remove the bandage. There are different complications which I don't think is need. Now, if at all, once you remove it, if there is a malalignment, malunited, a lot of malunition was happening during Corona time. People are scared to go to the hospitals and they come with malunited fractures. What we do? We should refracture it. Kanda bhagne pradude vishamolbana samhide apothya. See, I'll show you one refracturing. See, this is you should see, watch that blue churidar lady. She is giving pressure in certain marmas to reduce the pain. So you might be wondering, earlier also I taught you one during shoulder joint dislocation, sorry, elbow joint dislocation, which marma I pressed. Here also, see, refracturing is being done. Because of pressure in that area, the boy will not feel that much. There will be, of course, pain, but it won't be as bad as what you think. This is refracturing. This was earlier and this was after. Don't you think if I can do it, you can also do it? If at all there's an open fracture, what is Sushra says, Kalpe nirgadam shushkam vranande asti samahida, sandhyandeva kriyam kudya savrane vranabhagnavat. My father used to do all this. Nowadays, because I have enough headache other than this. So usually I don't take this, but I have certain slides with this also. Then after removing the bandage, you can see there is a innate stiffness over the fracture site. What should we do? We have to go for rehabilitation. Did Suchita say anything for that? Definitely yes. Mritpindam dharet purvam lavanam cha tataparam haste jada balam chabi kudyat pa. That means he is told go for graded exercise. Gradually move. Nowadays we go for wax bath. Earlier, boiling cow dung, not boiling warm cow dung, the patient is asked to immerse their hand and then start immersing in warm sand, then go for stones. Like that, the concept of rehabilitation was told in Sushruta. Now tell me, we have covered everything. Plaster of Paris was there, bandages, immobilization, traction, everything. Sushruta has given a complete text on conservation. Then coming for prognosis. Alpashino, anatmodo, janto, vadatmadasya, ubhadravirvasya, justasya bhagnam krichrena siddhati. Malnourished, lack of restraint, self-control, vada constant people, it is not that easy to heal. Then all efforts should be made to avoid any bhagna getting infected. Even today, a bone infection is not that easy to heal. Bhagnam naiti yatha pagam prayedeta tatha vishat. Pakwa mamsa sira snayu tadhi krichrena siddhyati. Then, what are the food you should take? All Brahmana food you can take. Shali mamsa rasa kshira sarpir yusham satinaja brahmanam ja annabanam syadeyam bhagnaya janada. See, total. He says, can I ask Horlicks? They will come in, can I take boost? Can I take coffee? The slogan you should remember is Shali Mamsa Rasakshira Sarpir Yusham Sasinaja Brimhanam Channavanam Syat. Then what are the things you should avoid? Lavanam Kadagam Ksharam Amlam Maithunam Adamam Vyayamam Nacha Seveda Bhagno Rukshanamyoja. That means avoid taking excessive use of salt, kadurasa, amlarasa, excessive use of pungent, spicy food. Then rest. Then what are the advantages of our this thing? We can open the bandage every third day. Then we can redo the bandage. And then we can use muruvanna. All these are the benefit of our treatment. There cannot be any allergy. There cannot be any swelling. We are not opening. So these are the strength of Ayurveda, which I always tell my students. See, this is how we pour. This is how our plaster will be. And then I told you in all orthopedic cases, we have an upper hand over the modern medicine. These are some of the exercises from our clinical practice. You can see the wedge compression fracture, central acetabular fracture. See, this is one I showed you after refracturing. This boy came and all my students were scared to take this patient. And on the 30th day, you can see him walking. I always tell my students, if I can do it, you should also able to do it. And Hastameva Pradhanendram. Always pray God. Before my father used to tell me, before you start taking any patient, always think the first day you started driving. You are very scared to start like that. You should very positively approach the patient, but be very, very, very careful. Just like you are going to start a car which is new to you. And because surprises will always come. I have seen so many patients which I think it is so easy will heal, becoming complicated, and so many patients, aged patients who I think he might not even survive 30 days because he will die before that. He are still living. So surprises will always come, and these are some of the Marma treatment. Gandha Thailand is one medicine which I use. Nadi Kashayam is another medicine which we use. And these are Mustadi Marma Kashayam, Anilom Shobha. Time is out. And coming to discussion, Ayurveda classics have enumerated skeletal injuries as 12 varieties of Kanda Bhagna and 6 varieties of Bhagna. It has to be remembered that all these diseases were done in the absence of current subspecialties. Even
Sorry
with
for
all
the
the
interruption,
advances
sir.
in the field of medicine and other allied science, till now, no other classification is as good as told by Sushruta. So, with all this, I conclude here. Abada Varjanam Nityam, Swastasya Anuvartanam, Utpannarthi Vigadasya, Manmanam Paripalanam. As I have promised you, this is my mobile number. You can contact me. I have WhatsApp in this also, where you can contact me when, if you are stuck somewhere, I will be able to help you. Not only me, my friends like Srivals and Vijay Nangeli sir, all these people are there. Matthew Swimbilly, all these people are very well versed in fracture treatment, and we will be able to help you. Our aim is to bring this science forward, because Shalyadandra is not anorectal alone. We have a lot more things to offer to the public, and this is one such thing which we have to bring it out. Thank you once again.
Thank you so much, sir. Now I request, if anyone is having any doubts, you may please ask to sir.
Sir, this Saptaha Chikitsa, can you tell again, please, what they are?
Yeah, whatever the type of injury it may be, whatever it can be, trauma, head injury, whatever it may be, you should start a treatment like this for 7 days. First day, you take a Ksheerapaga of Lajjalu, Mimosa pudica. Second day, I will share this slide to you all. Except the videos, the other things can be shared. And second day is Krishna Parni. Third day is Vasha. Fourth day Shalaparni. Fifth day Apamarga. Sixth day Vilva. And seventh day Kashmiri. You make a Ksheerapaga of all this each day and start giving to the patient. There is a concept for this. First day, this is meant for reducing the swelling, hematoma, like that it is been told. So that is, even today we are following that.
Thank you, sir.
Do we have any other questions?
Can I stop sharing?
Yes, sir. Yes.
Very, very thanks, sir.
Thank you, sir.
सुरेश जी बहुत बहुत धन्यवाद, बधाई। बहुत इच्छापूर्ण आपका व्याख्यान रहा। हमारे छात्र बड़े प्रसन्न हुए आपके व्याख्यान से, क्योंकि आपने आधुनिक और मॉडर्न और आयुर्वेद के ढंग से, दोनों ढंग से आपने सुंदर व्याख्या की। और इसमें जो है अस्थि जोड़, जो हट जोड़ है, उसकी भूमिका कितनी रहती है, कैसे दे सकते हो उसको, हट जोड़ को? हट जोड़ क्या कहते हैं डॉक्टर साहब? अस्थि क्यों डॉक्टर साहब?
सर
अस्थि श्रृंखला सर, अस्थि श्रृंखला, अस्थि श्रृंखला,
सिसस क्वाड्रेंगुलरिस,
क्वाड्रस, सिसस क्वाड्रेंगुलरिस,
सिसस क्वाड्रेंगुलरिस।
प्रयोग सर कितना कर सकते हैं? लक्षण ग्लू के साथ महायोगरा दे सकते हैं, दोनों मिला करके?
Sir, now we are using that Asti Sringala in Muruvenna also. Muruvenna is one medicine which we, in the proper text, Asti Sringala is not being told. But now we have started using Asti Sringala also in the Muruvenna. And Muruvenna can be given internally also, sir.
Thank you.
सुरेश साहब, आपने बहुत अच्छा प्रेजेंटेशन दिया, वेरी नाइस प्रेजेंटेशन, वेरी साइंटिफिक प्रेजेंटेशन, और आपको इसके लिए बधाई, कॉन्ग्रेचुलेशंस। ठीक सर? हाँ, भाई साहब डॉक्टर विनोद जोशी हैं। Very nice.
Thank you.
Nice presentation.
Sir, we should keep one day, we'll explain you how to do bandages, one day session on, not online, offline, sir. We can present it so that next generation can understand, because otherwise this is, knowledge is going to perish within a short time.
थैंक यू डॉक्टर सुरेश जी रिगार्डिंग आपकी इतना अच्छा आपने ज्ञानवर्धक हमें बात बताई उसके लिए आपका बहुत 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 साधुवाद
Thank you, sir.
Thank you, sir. On behalf of the organizing committee, I would like to thank Dr. C. Suresh Kumar, sir, for delivering such insightful lecture. I would also extend my sincere gratitude to our mentor, Vaidya Devin Tribhunaji, President GB RAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja ji, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would also express heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active contribution, make this webinar a successful one. Last but not the least, I thank each member of the RAV organizing team who worked behind the stage to make this event a successful one. Thank you, sir. Namaste, sir.
Thank you. Thank you.
all of thanks